Ruth, can you start by telling me a bit about your project?
Yes, so I was involved in a quality improvement project in my F1 year at a large teaching hospital, and this was regarding outpatient INR monitoring. So I noticed that quite a few of the patients who were started on warfarin whilst they were in hospital were discharged with about a 3 to 4 week wait to be seen in an anticoagulation clinic. And this was obviously quite worrying because when you've just started on warfarin, it's potentially the most dangerous period.
And so how did you approach the problem? What did you actually do?
So we set up a new service called the interim INR monitoring service, and this aimed to standardise outpatient warfarin monitoring. So every single patient that was discharged from the hospital on warfarin had to have a double-sided referral form filled in, one side of which referred them to the regular anticoagulation clinic, and the other side of which was filed in a folder on the acute medical unit. And by creating this folder, we had a record of every patient on warfarin who'd been discharged from the hospital. The haematology junior doctors then took on the responsibility of dosing warfarin for these patients until they were seen in the anticoagulation clinic.
I see. So if I was a patient, what sort of benefits would I see?
So before, patients were being discharged on warfarin and they might not know exactly what doses they should be taking. They'd be receiving phone calls from different doctors advising them on their doses. They might be turning up to the ward for an INR test, having to wait several hours before the blood test was taken, and this was leading to a lot of confusion. Obviously, some patients ended up taking the wrong doses of warfarin, which meant that they were at risk of maybe even having something like a PE or of a big bleed.
And you must have faced some challenges whilst doing this. Can you tell me about these?
Yes, so some of the junior doctors were initially reluctant to fill in the extra paperwork that was required to make the referral. But we got over that problem, and we spent a lot of time creating an online referral system, which then proved to actually be not very easy to use, so we had to abandon that.
And if you were going to do it again, would you do anything differently?
I think if I did it again, I'd try and get everyone in the project involved in a big meeting earlier on, so we could all sort of talk about our goals and aims at the beginning, because quite a few different people were involved. We had the staff in the acute medical units, we had the anticoagulation team, and also the haematology team were all involved.
And what did you actually get out of this personally for you?
Well, it was quite satisfying seeing that something I did actually made a change to patient outcomes. But I also got a lot of experience of working with different healthcare professionals, and I got to present my work at a national and international conference.
Great. And would you recommend this to somebody else?
I would recommend it. I think it was hard work, but it definitely paid off in the end, and I would definitely recommend someone else to do this.